Hi friends, hoping well. I'm Dr. Milind. So as NEETPG 2024 results are out, students are looking for different prospects and to advance into their careers. And one thing that always going to ask question for us is the debate that MD versus DNB versus diploma, and what should I opt for if my rank is not as I expected, but I want to still pursue the branch of my choice. Is DNB a good choice? So I just want to tell you a few things about it and my opinion on it. So we all know that the established opinion about MD and DNB. So things have changed a lot in the last few years. So as we know that MDMS is Doctor of Medicine and Surgery, and it is given by all the government medical colleges that we have in India. And DNB is actually a diplomat of National Board. And if you talk about the equivalence, because both are post MBBS 3-year courses that you can pursue, and they are have all are in the equal same kind of branches that you can do. Now there is a thing about equivalence. So traditionally we always feel that whenever you have a good rank we always prefer MDMS. DNB is not considered as equal to MDMS by a lot, like that is a general consensus. But if we look at what is official, what are the official guidelines say, so the guidelines say that if you are studying in a DNB college which has 500 or more beds, then you'll be directly considered as equivalent to MDMS. If your college has less than 500 bed, then you'll have to do additional 1 year of senior residency to gain that equality. So whenever you're applying for a job or any assistant professor, post that you want to apply or anything that you want to advance in your career to gain yourself as equivalent, you have to do that. Now, if when it comes to salary, it's now earlier there was a lot of difference between the salaries of DNB and MDMS. I mean, there was a stark difference that DNB used to get around 50-60,000 only, and usually MDMS salary, if you talk about the major cities like metro cities in India, it's more or less around 1 lakh. But now DNB is also giving the almost equivalent salary, especially in the metro cities, or at least trying to match the salary of MDMS. Now, that major difference that these two things have is one of the difference is bond. So MDMS in majority of states in India, like there are barring few states like Delhi, Haryana, they have this bond, and bond can be from 1 to 3 years. There are some states who had bond of like 5 years, 10 years. Although the bond is not being strictly followed in a lot of states, but you never know what can be there. So this is something troubling the students, especially those students who are like students from the north studying in south and students from the south studying in north or the northeast part of India, where there's a lot of issue with the language and the the food and everything they're feeling. So when it comes to the bond, it's very difficult, do your MD and then do the bond as well. DNB does not have any bond, so that is something I think is good. And when I talked about the equivalence, so when you have to do the 1 year bond in MDMS and in DNB, you have to do the 1 year of equivalence to become equivalent to MD. So it's the same kind of situation. Now, when it comes to the job preference, so if I am a DNB and if you are MD, so earlier the MDMS would be given the preferences in the jobs, but I don't feel and I don't see that happens now, because I have a lot of colleagues in a tertiary care hospital in India who have done DNB and working alongside me, and I think it's your performance in the interview and the exam that is now the matter of choice. The students from DNB, they're also building a very good CV. They're publishing a lot of reports, case series, reviews, and their CV is also as strong as MD. Because nowadays it's not enough that you just pass MD. You should have a strong CV, and you have to do a good in your research. Your research profile should be good, and I think DNB candidates are doing that good as well. So I think that is something that also you know giving confidence to students to choose DNB as their career choice. Now, passing percentage was definitely a factor that was stopping students from getting DNB seat. But trust me, the passing percentage has significantly changed. Although there are some branches, especially surgical, like orthopedics, which still have some worrisome passing percentage. But when it comes to medicine, pediatrics, this kind of branches, the passing percentage is definitely high. And if you ask me, I had a lot of friends who have taken DNB, and I think most of them, barring one or two who had to take, just give one more attempted, needed one more. But I would say that if like 50 of my friends who had taken DNB, at least 48 out of them have cleared in one go, and they had like 30-40,000 rank in NEETPG, and then they chose DNB. But they have done it in the first attempt, and on the top of that, they have cracked super specialty exam in the first go, like most of them. And I think this is something, as I am talking about the super specialty eligibility, both MDMS and DNB are equivalent. They have equivalent eligibility for all the super specialty branches you want to pursue. And actually I feel, if you want someone, like you feel like my rank is not good and I want to pursue this branch or pursue, especially like I want to go for DNB, I don't feel it's a bad choice. Because there's a day when you feel like, I want to hang my boots and I can't do it anymore, and I want to settle. As the world is growing competitive, I don't feel that DNB is a bad choice. Also, about the general perception in the public about MD and DNB, I also see it diminishing. Like earlier, definitely there was something like uh, you know that DNB was considered, but I don't think people look at that nowadays. If you're good in your skills, if you have build your CV good, I don't see that as a problem. And definitely the general public consensus is changing. Now if you are looking for a DNB, I just want to give you a few tips. First, if you are taking a radio through DNB, again I'll tell you, the radio taking from DNB is as equally difficult as MD, because a lot of students they choose DNB because DNB hospitals, they have all state of art equipments. They have these all MRI machines and CT scans. So doing a radio in metro cities is good because you should have all this infrastructure. If you go and do radio in very periphery where you don't have MRI and all this infrastructure, then it can be a exposure problem. Medicinal branches, I'll say, in DNB colleges are as good as MD because you get a very good exposure. And nowadays, people are going to private medical colleges to get treatment. And I think that exposure also you get good. Definitely, the MD student gets a better and more exposure, but I think still they are somewhere the same. Again, be cautious when you choose a surgical branch because you should be very aware that the location of the hospital, because the hospital which are surgical hospitals which are located in the big cities get a good hands on, and your f- consultant, your faculty will be more confident and more very open to give you the hands on if it has a good patient load. So that is something you should be careful while choosing the surgical branches. But I feel it's on individual basis also. If if you pursue your senior and if you impress them with your work ethics, they will definitely give you the chance to have a better hands on. And what I feel that even if you do DNB, if you feel like you are still taking it, if you feel like, okay, I did not have a good exposure in DNB, I still feel that after your DNB, you can do senior residency in a government hospital. You are equally eligible to do the senior residency, you are equally eligible to do the fellowship programs. So you can always sharpen your skills. You can always, if you feel like you did not get that much cutting or that much exposure in your DNB hospital, you can always go and join some government hospital. Lastly, talking about diploma, so we have a lot of diploma courses. You can go open the internet and you'll see lots and lots of diploma. Almost all the branches have these diploma courses. So especially those are who wants to settle fast, and if you're looking for a tier 2 tier 3 cities, or want to settle down in periphery. See, nowadays I feel that again as the doctors are protesting, a lot of things are coming out. And when engineer earns like crores of rupees when he gets the package, people celebrate. But doctor charging 500 700 rupees for OPD, people feel like that's a lot of money, and they feel like we are looting them. So some when you want to practice in periphery, and if you feel like you want to go ahead and you start your own practice, usually these people definitely they keep their fees low as compared to the other specialist. But you can thrive well in tier 2 tier 2 3 city. Obviously, as the course duration is short, you will have a limited exposure, but I don't see that as an obstruction. You can always gain experience with time, because as a student we are always learning. It's a never ending process. And definitely the earning potential is good. So if you're looking to settle down in such places, and if you want to start now, I think this is not a bad option to pursue the diploma. And these are all the branches that you can do. I have also detailed video on the YouTube, MD versus DNB versus diploma. I have where I have talked about the all the minute everything in the minute details. So I will mention the link in the description. You can watch this video also, that will help you. Just to summarize, so see, the world is now very competitive, that the cities are saturated with doctors and all. So first, most advantage will always be there. So if you have fixed the area that I want to start my practice here, so it's better that you start as soon as possible, no matter what degree you take. The world is turning competitive. See, I will say success satisfaction is individual's criteria. Maybe my definition of success will be different from yours. So if you feel like by doing diploma or DNB you'll be happy, you'll be more happy than the guy who did MD. So I think it's again on the at the individual basis. And I feel I have seen over the last 5 6 years, there are people, my seniors who have chosen DNB or diploma. I had my colleagues, and what I see that they are doing great. They are even doing better than some MD people in the path, because they are committed to it. And definitely it doesn't matter at the end of the day if you are ready to put in the hard work. And as I said, that society's definition of accomplishment is superficial, and I don't think that you should, take it to your heart, that it should you should put yourself in that frame. Lastly, it's always the MD who says MD and DNB are equal, because when a DNB person comes out, like I have done my MD and I'm telling you do DNB, do diploma. And that happens because I also used to feel, that the people, maybe, I used to say that you are very, this is not right because you're MD and you're telling me that to do DNB. But again, I'll say that these videos are just to tell you, because sometimes there is someone who need to tell you, no matter he's MD, DNB, or diploma. I got to know about the things after, after these experiences only. So I hope this video will help you in some way. I wish you all the best and take care.